am Nora. I'm the executive manager of WSA. As mentioned, we have 4 winners here today. Freeziana from Egypt, ZNotes from the UK, Telemadan from Chad, the first winner ever from Chad, and Lifeline from Rwanda. Are you guys ready?
Yes, right.
Cool. Then, hi dear,
Yes.
Freeziana from Egypt, go ahead. You can start whenever you are ready and
Yes,
share your screen.
Okay, I will share my screen. Okay, my name is Hadir Shalabi, the founder of freeziana.com. I am from Egypt. The story began in my village under poverty line, where there is no job opportunity for women in my village. The only available job is harvesting fruit with meager wage in unsafe environment. And although this woman made an amazing and beautiful handicraft product, but they don't know how to sell this product and earn money from their product, so they give up and they don't want to pass this product, learning this craft to their children, and that is why the traditional craft are slowly disappearing. In Freeziana, we wanted to solve this problem. We are building a bridge between heritage and innovation by supporting artisans across Egypt and Arab world with tools that they need to perceive their culture, grow their business, also reach global markets. Freeziana, it's not just a marketplace that help women to market their product and earn money and be and earn money. Freeziana, it's a community complete ecosystem that support artisans from learning all way to selling their product and earn money through these arms. Freeziana work through 3 arms. The first arm is Crafty. Crafty is an online platform that contain affordable course in craft, not just the craft, but also in photography, market, how to sell their product, pricing, make video, how to create a simple website, also how to write proposal to get funding, and so on. And the second arm is Istidama Center. We have 7 centers on the ground. These centers help the women in rural area and in village to learn them craft, and after they learn, they help them to find job and take this product to market it in Egypt and outside Egypt. Also, the third arm is craft bus or innovation bus. This bus is mobile classroom that travel to rural area and undeserved community, bridging education to doorstep. So in the village in Egypt, there is no quality of internet, so we made craft أتوبيس الحرف craft bus that come to village, help people to learn more crafts, and help them to spread the awareness about our website, how to can buy their product in our website, and so on. Also, in Freeziana, we wanted to merge between the technology and the traditional craft. So to make this faster and more efficient, we also use AI tools in our website. These AI tools like Sora, Dal, Evil Labs, and ChatGPT help the people. They don't know have any knowledge to make content, also provide, also create product design and visuals, and produce professional video to show their crafts and their art. Also write a very professional content to upload their product in our website. In Freeziana, we are so far supported more than 10,000 artisans directly to sell their product in our platform. Also trained more than 400,000 women and girls and youth from different regions in Egypt. Also created over 33,000 product design. we not just help these people to market their product, but also help them to develop their design to make trendy, to attract and help women to earn up to $3,000 $300 per month on average. As I mentioned in the previous rather than freeziana, they don't know, they leave their work, they don't have a suitable job and so on. But freeziana not just about handmade product, it also perceiving culture and heritage, empowering women and the blending between traditional and technology. We also create a deeply community that engage, help women and artisans to sell their product, building their capacity and flourish and earn more money. At Frisiana, we believe that heritage is poor. We turn foreign skills into income and lost traditional into hope. And this is a picture from our activities on the ground, online and offline. This is craft bus and Stedama, picture from Stedama centers. Also in innovation bus, our craft bus, we make toolkit. We give these people toolkit and open them crafty online platform to watch and learn and make product. And after they make a product, we take this product to sell in Frisiana. And that is all.
Thank you so much, Hadir.
Thank you
If
so much.
you might want to stop sharing your screen so we can see everyone who is joining again, and I would take the floor for any questions, comments from anyone who is joining us today, from those who've been part of the jury. Peter, you have a question. Go ahead.
I'm very, very happy that you could make this presentation, Hadir. This is wonderful. We missed you in Hyderabad.
I miss you all.
We missed you in many other places, and I'm very sad to hear that the US might close borders even for people from Egypt for unknown reasons. What I think what you're doing is so important in terms of basically using digital tools in order to give traditional crafts and artisans a larger platform outside of the markets. One of the things which I find very interesting and very challenging looking at the Egyptian development over the last years is that we still see, at least from the statistics, a very high level of illiteracy among women in rural Egypt. Now, what you are looking at is you're looking at literacy already in the digital space, in a digital domain. Can you just tell us a little bit about how you address this issue of building up literacy, which means that people are feeling confident and skillfully competent in order to communicate with other people using writing, reading, and digital tools?
Yes. As you mentioned, they are a big literacy in Egypt. So we try to simplify our process in Frisiana. And this what made us make Crafty Bus. The Crafty Bus travel to rural area and it's equipped with all tools that help this woman to create content with very easy AI tools. Also helps them to take a picture and simple picture to their product and apply it to our website. We try to with simple tools help these people to earn money, and this is load for our team, but with the AI tools and the future of AI, it's help us more and more. By one click, now we can take picture and make it and put it in mock-up, not just come with team, take picture and the models and so on. With AI tools in one click, made content, make product photography product session, and so on. So we try to simplify the tools and the way to this woman to make the process easy in Freeziana.
Very good. In terms of literacy, in terms of writing themselves or reading, how are you supporting that as well from women?
Not support this for women because we don't want the woman to have read and write, because as I mentioned, they made a beautiful product and they help them to take this product to help them to earn money. So
Okay.
our team make this part because if I focused in Freeziana, we have different categories. We have learned and the designer woman, and we have a literacy woman. They don't have read and write. And these people, just we learn them how to develop this product and take this product, sell them on our website, and give them a percentage of this product. So if we at the end of the day, we are a business. So if we are busy to make these people remove the literacy and help them to read and write, it will make our growth not easy.
Okay. Okay.
Thank you, Hadir. We have another question from Carlos Abler, our national expert from the US.
Hello. Thank you so much for all the work you're doing. It's very inspiring and just beautiful. So so I have a question that is somewhat related to the literacy question, but involves the family. As the economic prosperity of women increases, does in theory their social power, their agency, their ability to be effective. And I've seen in some other cases in other countries where programs like this will sometimes have accountability related to, for example, access of women to healthcare, access of women to literacy, to learning, of the family to learning. And in some cases, there will be an accountability mechanism where in order to be a part of the program, there needs to be some demonstration that the family, the children, women have access to healthcare or literacy and that kind of thing. Now, I understand that that can be completely outside of the scope of your focus, and it would require showing that the platform can deliver economic prosperity for that to be activated within the household. So, and I just give this as an example, not so much as a suggestion or anything like that, but more as a question. Does your program in some way consider the social dynamics within the family or in other ways within the community as a means of extending the economic power and enablement that this platform can help bring?
Okay, we do that, but not in our website. We make an Istidama Center. This Istidama Center, it's an offline places on the ground. These centers, we have a partner, and partner from non-profit organization, and these partners help the woman in medical health and literacy, and also something aids in help their children to return to the education, something related with mental health of this woman, because they are bird women or have some issues in their families. So it's not the Freeziana do with this, but the partners who made this, because it's some it's part of their values, and we partner with them. We have we do our work, learn women and help them to sell product, and the other partners give them money, also help them in literacy, help them in health care, help them in their children, and so on.
Thank you so much, Hadir. Is there anything that you currently, any challenge that you face, an introduction that you would need, anything where the WSA global community can support you and your freeziana and all the women that you work with?
Yes, so now in freeziana we are I wanted to come to Hyderabad in India to branding the freeziana and share the stories about women, and because we have very, very inspiring story about women. The women, they don't shame about they work in the previous, and now they are proud when they woke up and see their influencer, blogger, artisan wear from their product. They are very proud about their children, and yes, I know that WSA it's a large community, so we need help from mentors, open doors to international market to sell the product, not just in Arab world and Egypt and GCC, but we wanted to open new markets in European market and so on. And if someone help us to make our product innovative and social and environmental impact, yes, we are here.
So basically, it would be mentoring in first internationalization, secondly,
Yes.
maybe storytelling, and thirdly, sustainability, circular economy, any like how to make your project also by making sure it's environmentally friendly. Did I understand you correct?
Yes.
Good. I noted that down, and I will reach out to the community and then hopefully be able to connect you with someone within the WSA community very soon.
Okay.
Thank you so much.
Thank you so much.
The next person coming up is Zubair. Zubair has been, together with his team, recognized as European Young Innovator last year and could not join the festival in Graz, unfortunately, but we are very happy that he's going to present us ZNotes from the UK today. Zubair, whenever you are ready, you can share your screen and start.
Hello, my name is Zubair, and I'm the founder of ZNotes, the world's largest revision community of high school students that's reached over 6 million students and teachers globally. You see, the reality that I grew up with 10 years ago was that when we come to those standardized exams at the end of high school, the experience for students is not equitable. There are differences in the teaching quality, there are challenges in accessing personalized support, and there's even an inability to get access to relevant resources. The reality is that 60% of students do not complete secondary school education globally. But the opportunity is that we can halve global poverty if we ensure that every young person was able to complete their secondary school education. So at 16, 10 years ago, I decided that I didn't want this to be the reality that I lived in, and I wanted to make a difference. And that's where ZNotes started, as a way for me to share my own resources online. Today, ZNotes has reached over 6 million learners, and in particular leverages an open personalized learning platform to deliver learning resources for free for over 9 national and international qualifications that target students between the ages of 14 to 18. We have over 600,000 registered users, and our users feel more confident going into exams and actually able to achieve higher results, 90% more confident and 87% achieve or overshoot their target grades. We started with notes, and we've expanded into videos, quizzes, and even a personalized AI tutor to enable students to continue to understand questions and resolve their doubts. Alongside this, we have almost accidentally helped and started to help and support teachers who use ZNotes to deliver lessons, and especially in cases where they do not have relevant resources when they are coming to teach their classrooms. We have almost 70,000 teachers across 15,000 schools globally, and 80% of them are using ZNotes regularly in delivering quality lessons to their classes. A big part of ZNotes is to combine that learning content with a peer-to-peer experience. So let's say you have the best resources to prepare for an exam in biology, but if you have a doubt, how do you resolve that? We've cultivated a global peer learning community of over 50,000 students who leverage this space to resolve their academic doubts, but also as a way to redistribute social capital as they engage with each other and develop skills both on social and academic outcomes. At the heart of ZNotes is around youth empowerment. So from the learning content that's developed to the interns that are involved, to the ambassadors that are making awareness among their school communities, young people are empowered throughout the ZNotes organization. And to date, we've had almost 500 young people be engaged in our programs through our contributions, our internships, and ambassadorships. And the difference that we see here is not just that they're able to develop skills, but actually even feel a sense of empowerment, the power they feel that their content and their resources is now touching the lives of tens of thousands of students and their likelihood to continue their work in community and impact. We reach students in 190 countries with 85% of our users in globally south economies, particularly in Asia and Africa. And we are leveraged and benefiting students who are using it to prepare for exams and accessing top universities, as well as finding an opportunity to be part of meaningful change like Alexa. Alongside this, as I mentioned, teachers are using this as a resource, especially to deliver lessons where they are not able to access relevant resources. The ZNotes business model is centered around ensuring that our content remains 100% free forever. So we have been able to develop, uniquely think about where we monetize ZNotes in a way that allows us to sustain ourselves, but never restrict access to the content. So with universities and sponsorships, we've been able to benefit our community by sharing opportunities to apply abroad or within their communities, but leveraging that as a sponsorship fee for ZNotes to continue its efforts. We've launched our subscription model, which allows some students and some teachers to benefit from additional tooling, especially AI tooling, which is restricted in the number of prompts they can use on a free package, but allowing those users who have the ability to pay to contribute and subsidize the resources for everyone. And finally, we're at pilot stages to launch ZNotes for schools, an opportunity to have a B2B model where schools can subscribe and ensure all students in their classrooms can have access to the ZNotes resources. And we already have about 10 pilots running globally. I am supported by an incredible team. ZNotes has over 100 young people involved at various stages and an amazing full-time team that supports product, operations, and impact. And of course, I'm supported by an incredible advisory board that ensures that we're working towards the right areas, opening doors, and ensuring that we can scale our impact and scale our growth as well. My name is Zubair, and we're on a mission to fight educational inequality for young people everywhere. Thank you.
Bravo, Zubair. I think everyone is now impressed by your amazing numbers and reach and all the impact that you are measuring. So any questions?
Sure, I have a question.
She also won the Youth Award many years back and is now a juror, mentor, moderator, and beloved member of the WSA community.
Thank you, Nora. And thank you, Zubair. Amazing presentation. You really showcased a great innovation in what you guys have been doing and the impact. I am curious, though, how do you ensure the accuracy and the credibility of the student-generated content compared to, say, other AI-generated resources?
Of course, and thank you for the question, Gloria. So the way that ZNotes works is that we select the top students globally. We receive over 1,000 applications from high-achieving students who share their motivation, but also their actual exam transcripts. We then have a very rigorous interview process where they're selected, trained in our methodologies of content creation. We then have internal teams who moderate the resources. Then we have volunteer teachers who act as expert reviewers who review the content, and then we have that published online. And even after that, we have a Wikipedia-like functionality where any inaccuracy or typo or error can be reported by the community, and that is continuously monitored by a content team as well. So that is I think we select maybe 7 to 9% of our candidates that apply, and we are only selecting those students who've achieved the top results. And many of them are not just great students, but actually world toppers or Olympiad winners, or, the highest academics globally. So it is a highly selective process, and it isn't a crowdsourced, but a very highly curated and rigorously reviewed process.
Thank you very much, Zubair. I'm awed by the reach which you are having. And you look so dapper and so businesslike that I'm afraid that you might be a CEO of a large multinational company running in 180 countries soon. I'm not as privileged as you are, as Gloria. I never won the Youth Award, so please have pity on me.
Not at all.
I never had this incredible chance. I went to your website. I have 3 questions, Nora, if I may. The first one
If there are quick questions, then yes.
Thank you very much, Mrs. Woloch. The first one is, you call yourself the revision community. What does the term revision mean in that context of what you do with ZNotes?
We are very centered on ensuring the support for exam preparation, and not always can ensure the learning content will enable full learning development, and that's important for us to distinguish. So oftentimes students use it alongside a school or a tutor or support system as well.
Do you work with some push technologies as well, so that people have basically algorithmically supported in terms of what they do in memorization?
Not currently, but there are current study plan mechanisms that we're implementing, which are going to leverage AI and personalize that experience based on your learning traits.
Yeah, okay. Because I'm asking this because of the tradition which has been called microlearning.
Correct.
That might be a good way of basically augmenting this.
Yeah.
There are the two other questions which I have is, one is a very, let's say, provocative and economic one, and the other one is a pleading one.
Okay.
Provocative is, how much are you hated by the textbook companies like Pearson? I think I saw that you have one of from Pearson
Absolutely.
on your advisory board. But how much are you hated by them, because you're basically cutting their business?
Coincidentally, I have a meeting with Cambridge in a few minutes after our call today, and I have many advisors from Pearson, the Oxford AQA exam boards as well. We position ourselves not as competitors. We have been very explicit that they still need to create high quality qualifications. They still need to validate it at a global scale. And what we're doing is actually ensuring people at Cambridge, at Excel, and even national curriculums have support mechanisms where they can't do things themselves. Now, Cambridge can never go out and build the largest student community because they're working only with schools, leadership, and examining bodies. So we are kind of doing this from bottom up. And I'll be honest with you, it's taken a long time for us to position ourselves explicitly so they don't see us as competitors. But I think they're realizing that they need to adapt and change anyway. And the future assessment is going to change very rapidly as well. So have more good relationships at this stage right now.
The last question would go to Kaya, our youth ambassador from Poland and also an alumni. Kaya, go ahead.
Hello, thank you so much, Nora. Hi, Zubair. I think this is particularly relevant to me because I'm a recent graduate from UK university. So I feel like what you're doing is amazing for the student community. I would like to ask you a bit more about the ways that you measure certain things. For example, you mentioned a lot of students boost their grades or kind of go over the grades that they have planned for themselves through using your help. And I was wondering how you measure that. Do you have any kind of pre-usage surveys, post-usage surveys? Yeah, thank you.
Of course. So impact measurement is a really critical part of how we operate at ZNotes, and we've for various programs where we have engagement at a pre-stage, we have a pre and a post survey that includes many of our fellowship programs. When it comes to students on the platform, we have a certain user timer. So after 5 hours of engagement at ZNotes, you reflect on how ZNotes is supported in your self-efficacy. And then finally, on the statistics, and that is at a large scale. The data I shared was on a sample size of about 25,000 students. So it's a highly reputable statistic. On the second statistic on exam improvement, that is a little bit smaller sample size, but for a few hundred students, and that happens when we have completed the exam results. The results often come out a few months after the exams are done. We then send out an impact survey, and students assess their exam result change as well as again, it's a self-reported statistic, but how much they refer ZNotes to achieving that result to be able to provide that final 87% improvement statistic. So it requires a lot of kind of treatment because it's at different scales and it's obviously self-reported, which makes it a bit of a challenge. But hoping when we go to a B2B model where schools are working with us, we can get direct exam results, and that will allow us to make more measured impact statements as well.
All right, thank you so much. That sounds great.
Thank you, Kaya.
Zubair, is there anything that the WSA community can do for you besides bringing you this time to Austria, since last time it didn't work?
So we are actively looking to localize ZNotes in national curricula. I think we've been able to do quite well in international curriculums and allowing us a global scale, but really the impact would be when we can serve national curriculums and particularly under-resourced systems. So we've launched in Nigeria for the WAEC, in India for CBSE, and in Pakistan for FBISE. We'd love to find channels to promote students to engage and become content creators in those exam boards, as well as potentially identify partners that can enable us to launch a new curricula. So we have the technologies, we have the infrastructure, but we basically need implementing partners to support us in those national systems. So if you think that ZNotes could support in an education space, we'd love to kind of connect and discuss this further.
Thank you so much, and good luck with your next meeting that is coming up. And we are moving, as mentioned already, for the first time, we do have a WSA Young Innovator coming from Chad, and this is Telemadan. He could not join us in Hyderabad because the government was so impressed by his beautiful product that he said, we want to go on a field trip with you. And the impact in the country was more important for him than coming to Hyderabad, which is very laudable, but we cannot wait to hear your story now. Abakar, the floor is yours.
Thank you very much, Nora. Hi, everyone. So I'm going to share my screen. So hi, everyone. I'm Abakar Muhammad from Chad. I'm the founder and the CEO of Telemadan. So let's go. Okay. But before we start, please allow me to take you back in 377 before Christ. The next day after the death of the father of the modern medicine, Hippocrates, when his son, Thessalos, came saw the king to ask him for independence of his father's will. He came to see the king to ask him to recruit more doctors, to put more resources, to recruit more doctors, to train more doctors, because Hippocrates knew what was coming. He saw the danger from growing city and the lack of doctors. Indeed, in Chad, the country I came from, we are 17 million inhabitants for just 2,000 doctors. We are far away from the WHO standards, which recommends 23 doctors for 10,000 inhabitants. In Chad, it's saying like 1 doctor for 8,000 Chadians. And it's not just a Chadian problem, it's an African problem, and also it's a global problem, because more than 2 billion or 3 billion people around the world don't have access to healthcare services. And this is due to the high rate of extreme poverty and the lack of infrastructure. So that's why we had to come with a solution that will bring effectiveness, affordability, and innovation. So we designed and built Telemadan. So what is Telemadan? Telemadan is a medical kiosk that we designed that is powered by solar energy and connected to internet that we deploy in remote areas to allow remote communities to have access to healthcare services with doctors located in Jamena or one another country in Chad, the city. So our value proposition is that, it's affordable because the teleconsultation fees is set at $2 to $5. Before, people had to spend like $50 to $60 just in transportation to come to the city to find a doctor. So now they can have a consultation in their own area for $2 to $5. And also we have the sustainability, because we are using solar energy, because we take in charge that in remote areas there is a low rate of electrification. Just 1% of remote areas are electrified. And we are working also with NGOs to map, to localize the key areas where there is the large amount of medical deserts. Our business model is simple. It's based on grants, impact grants. We are also renting our kiosk, and we are also taking fees from teleconsultations. So our business model is based on these 3 mainstream. So impact to date. For now, we have deployed 37 Telemadan stations and conducted over 250,000 teleconsultation to impact more than 60,000 people. And this is due to our partnership with the Public Ministry of Health and the National Digital Health Program. And in remote communities, we had an over 50% of user retention. and also 70% of diminution of out of expense for healthcare services. So for our future projection in the next 2 years, we want to deploy 100 more kiosks, because in Chad, we have 23 provinces and distributed in many districts. So yeah, in the next 3 years, our goal is to launch 100 telemedicine kiosks. So we have also an interesting program, which is the SDG 3 Youth Program. So it's a network of over 2,000 young volunteers that are located in each community that we are going. In each province, these young are helping us to, promote SDG 3, promote telemedicine, because, before we move, we have to do campaign awareness to let people know that this is a solution. This is a solution that will help them. They don't need to spend money or to spend time to go to the city for just a teleconsultation. Yeah. So 40% of them are women, 20% of them are refugees from Sudan, because there is the war in Sudan and they're all coming in Chad, and 15% of them are ethnic minorities. So here are some pictures that I got for you to see our work on the field. So our growth plan, like I said, in the 1 year is to expand to 25, and this 3 to 5 year to more. And we are asking for 1 million. We are trying to raise money to do that. And yeah, that's the detailed growth plan. So our key team member is me. I'm Bakar Mohammed, the founder and the CEO. We have Ahmed Kotoko, which is the Chief Operation Officer. We have Mr. Senusi Ahmad, which is the product manager. We have Bertrand, which is the project manager. We have Gladys, which is administrative assistant. We have also Chanceline, which is our financial manager. We have also Dr. Umayma Jarma, which is she's our advisor boarding. So she helped us. She helped us a lot to to let our solution know among the doctors. So yeah.
Thank you so much. And we have already a first question from Carlos.
Thank you for this. This is inspiring and really fantastic. So I have a question. It's kind of two questions, but they both have to do with funding. So you mentioned at the beginning that that you were funded by grants and that kind of thing. At least that's the impression I came away with from the beginning. But then toward the end, you mentioned that you're trying to raise $1 million. So and I'm wondering, is that also based on grants, or are there other incentives for why people would invest beyond just philanthropy? So that's one part of it, but there's another part that's still very close to this, which is one of the things that's impressed me over the years is that we see these incredible solutions that help to address the issue of healthcare access, everywhere using the internet, using content. And there are tremendous partnership opportunities with corporations that are often underleveraged. When I was at 3M, one of the things I was trying to do was to bring WSA genius into the company by saying, look at these incredible solutions that people are delivering in countries such as Africa, Latin America, etc., that are getting 1 million people into a database in 6 months or within a year, and delivering, for infant and maternal mortality reduction or whatever, are having a huge impact in terms of the traction they're getting. And what I would say to them, to people, for example, in respiratory and other areas who are concerned with air quality. So we all know air quality is a big issue with impact on public health, and it's only going to get worse. So the thing I would say to them is, here is a venue to raise awareness about air quality among young mothers or whatever, and here's a way to expose your brand to these countries, even ahead of your ability to deliver products into those geographies as you're working with their expansion strategies into Africa, into Latin America, etc. And what I was trying to get them to understand was that in a way, this is advertising, but also in a way it's not. In a way, it is delivering social impact through a partnership, through people where the goals are aligned. They want to sell products that help to save lives. You want to deliver a product that helps to save lives. So anyway, I bring this up as an illustration leading to a question. are you looking at, or have you considered some ways in which other for-profit organizations could leverage your platform as access to be able to find a way to help support and make your initiative more sustainable?
Thank you very much for your question, for questions. So for the first question, yeah, I said grant funding in the beginning, and that we want to raise 1 million. So in the 1 million, it's a bit mixed about impact funding and also equity. So yes, we are now in a accelerator program with Vilgro Africa. They are helping us to refine our business model, to refine our financial model, so we can get ready to our fundraising. So yeah, for example, last year we got a grant from Expo City Dubai Foundation. It was $100,000. So that's a grant. So we were able to deploy more kiosks and to go to the field. And it's a recoverable grant. So we are making profit from it. We can get it back. So yeah, for the 1 million, we are looking for mixed, equity and also impact grant. So for your second question, yeah, we are looking for partner that will, make our impact wider. But it's very difficult, from Chad, for example, we have to look from outside partners, because in Chad, we are not that, it's a low middle income country. So we don't have this kind of opportunity yet, but we are trying our best to find, some partner that will help us to widen our impact in the many fields that you mentioned.
Thank you, Abakar. We have a next question from Captain Donald.
Yeah.
Thank you, Nora. Thank you for your solution. I know we've met before online, but my question is, what is the cost of a kiosk? And the second part of the question is, are the materials you use for building the kiosk local, or you do import them? Thank you so much.
Thank you very much, Donald. The kiosk, the cost of one kiosk is $10,000. This is the full price that we sell to the government, to the privates. But the end user, which are the patients, they are just paying teleconsultation fees at the kiosk station. So the price of one kiosk is $10,000. So for the material, yes, we are all building that locally here in Chad, but from some materials we are importing. For example, the ECG analyzer for the cardiac, the screen, all the other stuff, the electronical stuff we are importing. But for the kiosk, the design, the hardware, the software, we are building that here locally in Chad. Yeah.
Thank you. We have a question from Oscar, our winner from Guatemala.
Hello, everyone. Thank you, Nora, and thank you for your pitch. It's a great project. I know you are IoT engineer, right?
Yeah, I'm IT engineer.
Not to be so technically with my question. So it's a beautiful project. And my question are more part of technical. It's, for example, what architecture are you using to connect, for example, your kiosk to your client server connection? For example, you are using edge computer, you are using cloud, and in this case, what is your strategy to ensure the connectivity in the areas with the poor or unstable infrastructure? With a low connection.
Exactly. Thank you very much for your question, Oscar. So yes, in the remote area, like I said at the beginning, for electricity first, it's a huge problem. So that's why we are using solar energy to switch this problem. For the connection also, it's a huge problem. That's why at the beginning we are using cablet internet with RG5 or RG45 cable to limit the bandwidth. But now we are using Starlink because, in the most remote areas of Chad, we don't even have the network. So combining solar energy and Starlink, it's perfect. We are connected every time. So we were able to tackle this problem now. by 2024. Yeah. But before that, we had some problems, some issues with the connection because some areas are not covered by the network. But now, thanks to Starlink, it's okay because you have to know also that they lift the ban of Starlink just last year. It was banished in Chad. So Starlink just got his license last year. So that's why we were able to use it. So now for the connection, Starlink was our solution. So it's okay.
Okay, thank you.
You're welcome.
And we have a question from Ali, our national expert from Iraq.
Thank you, Abakar, for your solution. My question is about supply and demand. You are deploying 100 more stations. That means more demand, but you mentioned in the beginning that Chad has a problem of very little amount of doctors. How would you solve this? I would think that after 100 stations, the next goal, you would be having less doctors to provide the service.
Yeah. Thank you very much for your question, Ali. So, I mean, for our solution, we are totally conscious that we are not replacing the doctor. We are not there to replace them, but we are there to alleviate the problem and to help them to manage more this stressful situation. So, like I said, in Chad, we are 17 million inhabitants, and the capital, the city, Jamena, we are just 1 million and a half. All other the 80% are located in remote areas, and all those doctors, are located here in Jamena. For the 2,000 doctors, 90% of them are here in Jamena, because of the quality of life, So they are all here. They don't go to provinces. It's very rare. So the demand in province is very, very huge, and 100 kiosks is just a little number. That's just the short-term goal. But to fight against the whole thing, the whole medical disease, it will take more. It will take more. But for the moment, we want to see what 100 more stations will do to alleviate this. Because when we deploy our kiosk, we can witness, the decrease of people coming to city for just a teleconsultation to find a specialist. For example, a dermatologist, a cardiologist, or something like that. They can do it, in their own area. So if they have a complicated case, so now they have to move to come to the city for an operation or something like that. But for the moment, yeah, that's how we are seeing things.
Thank you. We have a last burning question from Peter.
A lot of the issues, and especially what you do, Abakar, is so important that you go into the rural, non-metropolitan area of Chad, that you are really reaching out, that you're really doing something which is against this concentration of doctors, which we have in many, many countries, and then the rural areas are just underserved. The issue there is, but however, is the maintenance of the equipment, the maintenance of basically the support. So that would be my second question. The last question is even more difficult one, is all the kind of things which people, can say or consult with depend on that they have learned already about personal hygiene, that they have learned about personal health issues, that they can tell about what the problems are and how you're dealing with this kind of learning component. The question first was maintenance of equipment. The second one is learning side in order for the consultation to work well.
Yeah. So thank you very much for your question. For the first question, for the maintenance, yeah, actually, every time that we come and install our solution, we deploy, we train local health workers to maintain the kiosk and to be also the intermediary between the kiosk and the patient. Because, also in remote areas, and particularly in Chad, people are not that, they don't have a literal level of using technology, or, they are not at ease each time. So that's why we choose every time to train at least 2 health workers to maintain and to be the intermediary between the machine and the patient and the doctor. So this is the middleman. So for the maintenance, it's that way. For the hardware, for the software, we can do the maintenance in our office here. It's okay. So it's just with distance. We are updating things, and we are launching to the server. So everything is doing well. So if there is a huge problem, maybe for example the screen of the kiosk is broken, has been broken, or something like that, then we move to the remote areas to change it. We have a contract maintenance with the government when. So that's it. So for the second question, yeah, I mean, when the patient come for the first consultation with his doctor, so he gave him a lot of following. For example, the patient can make an exam at the lab and then scan the result through the kiosk to his doctor to receive it in numerical form, so the doctor can see it and resend, for example, an ordinance or a medical billing that the patient again can print via the terminal. So there is a follow-up after the teleconsultation with the local health worker and the distant doctor. So there is always. And now this year we launch our mobile application, which is now available in Android, but not in the Apple Store yet, because we still have some complication. So this mobile application help the patient to have all his data in his mobile phone, so he can check and he can do his follow-up by himself. And receive also, of course, health tips and every other stuff.
Excellent. Thank you.
Thank you, Abakar. Is there anything the WSA community can support you with?
I mean, you guys are doing great for the moment. We received a lot of support. I just didn't have the opportunity to come to India. Maybe next year, I don't know. For the support, yeah, I mean, just please connect us with like-minded people. It's very important, so we can grow together and still learning, because that's our key force.
Thank you, Abakar.
Yeah.
We stay in Africa, and we have one more pitch for you, and this is King from Rwanda and his project Lifeline.
All right. So, hi everybody. My name is King, and I'm from Lifeline. And yeah, we are basically Africa's first medication/clinical software with third-party insurance integration. We help people access healthcare at nearly zero cost. And I'm just going to ask everybody this question: who here has ever been, let me say, screwed by their insurance? If you have ever been screwed by your insurance, you can just raise up your hand in the chat. So yeah. And we're actually going to look at the problem statement and metrics. But first of all, I actually want to tell you guys why Lifeline actually began. So you see, yeah, during my college years in Rwanda, I went to a pharmacy one day to get my medication. And unfortunately, the pharmacy had my medication, but I'm sorry, King, we don't support your insurance here. Quite a crazy situation. The next pharmacy supports my insurance, but they just actually ran out of the medication I needed. And this is actually me stranded on a Saturday morning and I actually needed these things as quick as possible. And you see, as a college student, finances was quite tight. So, I mean, I have insurance, but I just literally couldn't use it. So, and unfortunately, I'm sharing this problem with 269 million people on the continent, whereas almost 80% of Africans cannot afford healthcare at critical times when they need them. I was literally one of them. I am still one of them, kind of. And 95% of the population literally lacks insurance at all. And because of this problem, basically, 1.6 million people have died as a result of this. So with all this story and all this data, what is my problem statement? Basically, gaining access to pharmaceutical and clinical products in life-threatening emergencies is a very frustrating case. It can be frustrating. Affordability is a very big barrier for many patients while trying to manage their health expenses. You see, one thing I actually understood about working in Lifeline is not everything accessible is affordable. Accessibility and affordability are very different things. And lastly, millions of people on the continent are struggling to keep accurate record of their medication and clinical data. I'm just going to pause here and ask everybody this question again. If you can keep track of every single medication and clinical tests you have done and taken in the last 1 to 10 years, without the help of your local pharmacy, hospital, or insurance company, please, just raise up your hand in the chat. That would be really cool. But most people actually can't. Millions of them actually. So what is my solution here? I present to you Lifeline. This isn't just some app that we actually built. It's more like an ecosystem that does three things basically. Helps you access, afford, and manage life-saving medications and clinical tests at nearly zero cost. Basically, at Lifeline, we are promising you healthcare for free. I know it sounds insane, but we're literally able to pull it off. How does it work, basically? You see, we're actually able to customize our own GPS on the mobile app, whereas instead of Google Map just showing you where a pharmacy is located, you can literally find medications based on your geographical location as well as tests. And at the same time, we also introduce the outpatient care tracking. The question I asked everybody previously, can you keep track of this medication and clinical data on your own without help? Now you don't actually have to think about it anymore. Every single one of your medication and clinical data is actually logged in on blockchain, and it can't actually be changed or tampered with at all. And we also have drone support for people who live in the rural areas, because this is Africa. Not everywhere a vehicle or a motorbike can actually get to. And we actually work with Zipline here in Rwanda, and they already ship medication. So they already transport blood with drones, and we're like, hey, can you guys also transport medications with these drones to people in the villages? And it was quite crazy, but we're actually able to pull it off. We've done about 500 drone deliveries with Zipline, and we're the first healthcare company in the continent that allows you to use your insurance remotely from anywhere in the world. So let's say, for example, now you're in Austria and you actually have an insurance there. Most insurance companies do actually work outside the particular country, but as with Lifeline, if they actually work with us, you can actually utilize your insurance even in a different continent. That's currently what we're doing right now. And for those that don't even have an insurance at all, we literally built an insurance search engine to also help insurance companies generate revenue by selling insurance premiums to people that actually want to buy an insurance. You see, the reason why 95% of Africans don't have insurance isn't because, they can't afford it. I know that most people can't. But insurance companies make it very difficult for people to even make these purchases. You have to have a lot of calls, a lot of emails, and all that. So basically, with just a few clicks, AI can actually help you get an insurance policy based on your budget. And what is our impact so far? Lifeline is actually about 1 year old, but although, the company on paper is 1 year old, but we've actually been operating for like 6 months. We started our beta testing in September, and as of January, we actually started our public testing. So we're not like fully public yet because of, working with different insurance companies, it's quite a lot. So we're just trying to take it one step at a time. But so far, we actually have helped about over 3,000 low-income earners access free healthcare with a subscription. Because you see, part of the reasons why most people don't have insurance because it's quite expensive. Not everybody can actually pay $500 to $1,000 a year. That's literally like their yearly salary. So we actually introduced our own micro insurance within Lifeline that just starts at $3 to $5, and about 3,000 people have actually purchased this, and most of them actually university students. And at the same time, I've helped over 243 healthcare providers increase their visibility by 300%. Because one thing I tell people is that Google Map we actually tell you where a pharmacy is located, but it's not going to tell you what medication they have, what insurance they take, and if they're actually open. So with Lifeline, basically, we became like that Google search for people that actually are seeking certain healthcare services. And in literally 5 months, we've processed over 200K in healthcare transactions across over 200 healthcare providers that work with us. So we're a very lean company, and then we're just 9 of us from 6 African countries. This is I myself, I'm a programmer and a 2 times founder. I also have Goodluck, my CTO, as also a software engineer. And then we also have Mohsen, head of product design. And 60% of the team are actually females, which I'm really proud of, honestly. So these are our board of advisors. They actually have over 100 years of experience combined, helping us in every step of the way to actually make the right decisions. Because in as much as I'm a 2 times founder, I don't really have a lot of business experience. So I actually rely on these guys to help us shape the business model and, make sure we're doing the right thing, because the healthcare sector is really regulated and it's quite tricky. So when the cost of health is impossible, we are your lifeline. Thank you so much. So this is our website, and if you actually want to reach out to us for partnerships or anything, this is our email. You can take a screenshot or anything. And then we really appreciate WSA for actually giving us the global recognition and a platform to actually share our story and tell the world what we do and support us. Thank you so much.
Thank you, King. Any questions?
Lifeline is what you have described is an incredibly ambitious system.
Thank you.
It's an ecosystem more than just an app. And I really appreciate that. And I think from my point of view, what is really interesting is that healthcare is an incredibly wide area. I mean, it starts if do you have access to a dentist? Do you have an obstetrician for birthing? Do you get contact to a midwife? Is there somebody there who is looking after your cancerous melanoma? So that's a huge, huge area. Where do you see that there's the most demand for Lifeline, and what's the profile of the user which you have? I mean, we are all always, in terms of WSA, we are always driven by the product, by the solution, by the application. But I want to get a little bit more, a better feeling of who is the user and how are they basically interacting with you, and what is their understanding of what they can benefit from. Please, King.
Thank you so much, Peter. Lovely to answer. So originally, Lifeline, when we actually started, we started with pharmaceutical, helping people actually find their medications cheaply and actually faster. But there was a problem. Like I said, not everything accessible is affordable. And what's actually going on in the healthcare system right now is a lot of monopoly, because most of these other companies, like big pharmacies, they just have websites that only sell their own medications, literally. And they actually take advantage of the fact that, for example, in Rwanda, there are 770 pharmacies in this country, and only 2 of them have websites. So literally the rest of them just rely on WhatsApp and actually emails and that sort of thing. And only 2 pharmacies could actually come out, build their own website, and actually give themselves the visibility. So you can actually go online and you can actually see like ibuprofen for like $2. And somebody else might actually be selling it for 2 cents. But the problem is that you don't know. And as tech-savvy individuals, we don't actually have time to be driving around. So we just actually we actually purchase from the first person we see. And actually saw that as a problem, because a lot of people actually selling things more affordably and even have better quality, but nobody actually knows where they are, basically. So we actually started with pharmaceutical, helping you get access to your medications faster and cheaper. But then there was a problem of affordability, because not everything, like I said again, not everything accessible is affordable. And I was like, wait, I pay for insurance every single month, and I've literally not used this thing. Why is this actually the case? Because one thing I actually noticed is that insurance companies make it very difficult for you to actually use these things. In fact, the first fight we had with the company was the insurance companies, because when they saw what we did, in fact, it kind of broke their entire business model. It's a very big problem for them, because now they are at risk of actually losing a lot of money, because now I've actually built this tool that allows people to use their insurance anywhere in the world. It's just quite insane. So, but then we actually did 3 things for the insurance companies, basically. So for the pharmacies, we were able to actually give them visibility and increase their revenue. So for the insurance companies, we told them 3 things. We're going to help you increase your visibility. Let's say you guys actually come to Rwanda right now. You want to buy an insurance for the 3 months or 6 months you're going to be here. The first thing everybody's going to do is Google. And when you Google, you're actually going to find yourself calling these guys, sending them emails back and forth. We built an insurance search engine. I literally spent company money building a search engine for them, so that instead of you manually calling these guys, AI basically finds the best policy for you within seconds. And if you actually want to pay, you can actually pay on the spot. So now they've actually increased their visibility and also helped them increase their revenue. Now, and at the same time, on the patient side, we also we actually improve their customer experience. Because you see, typically, if you want, let's say for example, Nora comes to Rwanda. If she wants to use her insurance, that kind of thing, she has to physically visit the facility. Now with Lifeline, she doesn't need to physically visit that facility. Lifeline is like Amazon. You go there and shop and get anything you want. But during checkout, we don't just allow you use your own money. We are like, hi, do you have insurance? Put in your insurance membership here, and we actually authenticate it instantly. If actually Nora has an insurance with this company, we can see it. We are literally plugged into the database within seconds. So, and then you can actually use your insurance as a payment method. That's why we actually say healthcare needs cost.
Got it. Got it.
Thank you, King. We have another question from Babak.
Thanks. Very nice. I don't have a question actually, but a remark. I seem to remember that this year's winner from Sri Lanka operates in a very similar space, also in connection to delivering healthcare products to already insured individuals, I believe. But the matchmaking is very similar, I believe.
I'm very happy to make an introduction. Yes. Yeah. Are there any more comments, suggestions, questions? Or does King want to share how the WSA community can help him support it? No, Amos, we have a question from our national expert from Nigeria.
Right. Thank you so very much. Thank you so very much, everyone. In fact, actually, I just witnessed an inspiring set of pitches, since we started, and it's quite fun. And I was so happy when I saw Peter's mail last night, and having it today and witnessing this is I'm grateful, particularly in fact, for everyone, not even for the last speaker. Everyone did very, very well. In fact, as an expert and an innovator myself, I'm very proud. And I will continually get impressed by the rising wave of purpose-driven solutions, shaping our world like this. And to WSA, I say kudos and apologies. Again, I couldn't make Hyderabad once again, but I really plan to. In the house, I can see some real good faces. Faces that I've missed in Hyderabad. I can see Dorothy. I can see, I don't know whether, okay, I can see quite a lot of other people there too, actually, but then not to waste your time, I say thanks for all the presenters. And quite frankly, you guys have done, you've done very well. In fact, your defense was also superb. And I say thank you once again.
Thank you, Amos. That sounded almost like closing words. Peter, is there anything that you want to add for the community before we just go to a more informal networking part where people are invited to share and stay and exchange again?
We are talking a lot through the new ways in which AI works about transformers and transforming a lot of different things through digital. I want to say and put in contrast what WSA does. WSA is your means to transform the network capital of knowing each other or knowing of each other to something which is friendship capital to support each other, to care about each other. And what you saw today in all the different kind of presentations, that underlying the use of technology is the passion of people, if it's King, if it's anybody who has presented and asked a question, that you are really people who care for what we can do with the technology. And there's an enormous demand in this world today where we talk about polycrisis in various different ways, where we are not dealing with the climate challenge as we should, where we are having economic shortages, rising inequalities, and in many regions of the world, wars which are devastating. It is very important, the WSA, that you are actually a community of people who care about what you can do with technology, how we can achieve the SDGs, how we really can improve the lives of everyone, including ourselves. And I want to thank you for that. And I think it's highly inspiring and helpful to everyone. Thank you, Nora and team, for organizing this.